So this is a seated flexion extension exercise, and this can be really valuable for people who are still quite tentative or experience discomfort in being able to sort of roll down and reach towards their toes in a standing position. This tends to do two things. It physiologically prepares the body to be able to comfortably sort of flex forward while in standing, and it can also psychologically prepare the body to do that. A lot of people who've had a back injury can be very, very tentative to sort of reach forward to touch their toes, and that's absolutely fine, that's absolutely normal. But doing it in this seated position tends to feel a lot more safe, both consciously and in the nervous system, subconsciously. So people tend to be able to get a little bit more range of motion in this seated position. And it also, importantly, takes the glutes and hamstrings and calves largely out of the equation. So if you're someone like myself who has quite tight hamstrings, and that can be a limiting factor in rolling forward, doing it in the seated position takes that limiting factor out of the equation, so you can really get a nice rounding flexion of the spine. So Will, what I'm going to ask you to do is put your hands in the front of your legs and just slide your hands down your legs until you feel comfortable. And yeah, you follow with the spine, just keep going. Now, that might be enough for you. You might not yet be able to go all the way to sort of hang your head between your knees, and that's fine. Only go in your pain-free, comfortable range of motion. I've probably talked to you about this principle of kissing the edge of discomfort. Once you kiss the edge of discomfort, just calm back. And what you can do even is use your hands to walk yourself back up. So rather than just using the strength of your musculature of your back, you use your hands. So we'll roll down again for me. Perfect. And then what I'd like you to do is use your hands to push yourself back up. Perfect. That might be an option for you that's appropriate at this stage. However, as you progress through this range, or through this exercise, you're going to increase the range and start using just the strength and mobility of your back. So Will, can you show us a really progressed version of this exercise? He's going to roll all the way forward. You can see a really, really nice curve of the spine here, a very nice uniform curve. He's in a really relaxed position, head is dangling, head is soft, really can't go any further because his legs are in the way. You might even want to take a few deep breaths here and hang out and get, a lot of people find a lot of relief in the stretch that this provides. And when you're ready, instead of using your hands, you're going to use the strength of your back muscles to come all the way up. This would be the most progressed version of this exercise. That is the seated flexion. And then I also like to give this exercise for people who have an office-based job and struggle to find movement opportunities throughout the day. I have a lot of patients in that position at the moment, maybe you're one of them. And so what you can do is use this as a sort of chair exercise. So Will, I'd like you to come into that full flexion position. Beautiful. Just as a nice mobility movement, and then come up. And then what you're going to do is sort of lift your hands up and come into a slight extension. Beautiful, and then roll back down again to flexion. So you can do this as a mobility routine, particularly if you have an office-based, chair, desk-based job, to get a little bit of extra movement into the spine throughout your day. That is the seated flexion and extension exercise.